Hey, welcome to The Explainer. So today we are diving into something truly remarkable. We're looking at how an entire country is essentially rewiring its national health system using a completely new kind of AI. This is a story about turning data into life-saving action, and it's all powered by something called the Eagle AI. So let's just start with the biggest question right up front, because it's the one that matters most. How do you take all this health data that's being collected, every single day, and actually turn it into immediate, on-the-ground action that can save a life? And this whole story really starts right here, on the front lines. See, in Rwanda, you have this incredible network of community health workers, or CHWs. They are the absolute backbone of the public health system. We're talking about dedicated people going door to door, collecting vital information on everything from a new pregnancy to the first signs of a potential disease outbreak. But here's the catch. What happens to all that amazing data? Well, far too often, it ends up stuck in a bunch of different, disconnected systems. It gets recorded, sure, but it doesn't automatically trigger a response. It effectively becomes a data graveyard, just full of life-saving information that arrived too late to make a difference. And this really gets us to the heart of Rwanda's challenge. It wasn't that they didn't have enough data. They had tons of it. The problem was a fundamental bottleneck in the system that stopped that data from becoming action. Let's break down what that really means. You've got fragmented workflows, right? Different health programs working in their own little silos. This creates a massive administrative burden for workers on the ground. It leads to huge delays in analyzing what's going on, and it requires constant manual checks and oversight. All of this makes it pretty much impossible to scale up effectively. And this number, wow. This shows you the real human cost of that inefficiency. Just imagine being a health worker and spending almost half your day, 40 to 60%, just filling out paperwork instead of actually helping patients. That's the reality. This isn't just about things being slow. It's a direct barrier to people getting the care they need. So it became really clear that Rwanda didn't need just another fancy dashboard or a new analytics tool. No, what they needed was an AI that could actually do things. And this is where the Eagle AI enters the picture. It's all built around this core idea called Action First AI. Now, this isn't about you asking an AI a question and getting some advice back. No, this is an AI that's woven directly into the daily operations. It literally executes tasks, it triggers real-time alerts, and it coordinates the entire response automatically. This little chart here just spells out the difference perfectly. A typical AI might analyze data and tell you, hey, there might be a problem over here. An Action First AI sees that same data, automatically creates a case file, alerts exactly the right people, and then orchestrates the entire workflow to deal with it. It's an operator, not just an analyst. But wait, there's another piece to this that is absolutely critical. For a national health system, data security and control is totally non-negotiable. So the Eagle AI was designed as a sovereign AI, and what that means is that Rwanda keeps 100% control. All the data, all the infrastructure, all the decision-making rules. It all stays within the country, secure and fully owned by them. It's a huge deal. Okay, so that's the high-level theory. But what does this actually look like for a health worker out in the field every day? How does this AI actually become their partner? Honestly, the best way to think about it is that the AI becomes their co-pilot. It handles all of the annoying, time-consuming, administrative, and logistical work in the background. And that frees up the community health worker to focus completely on the thing that only they can do, providing human-to-human care. Okay, check this out. It's called the AI CHW Assistant. A health worker can be in a remote village, and instead of filling out a complicated form, they just record a voice note in their local language, Kinyarwanda, describing a patient's situation. The AI instantly understands it, creates a perfect structured case file in the system, and here's the magic. If it detects any danger signs in that voice note, it automatically triggers an emergency referral to the nearest clinic. It's a seamless flow from a human voice to life-saving action. Or let's talk about disease surveillance. The AI is constantly, and I mean constantly, monitoring all the incoming reports in real time. So if it starts to see a little cluster of fever cases popping up in one area, it can analyze the patterns and say, hey, this looks like a potential malaria hotspot. And then boom, it instantly alerts the district health officials so they can get a team out there right away. This is the big shift from just reacting to an outbreak to actually getting ahead of it. It also works like a personal trainer for every single health worker. Let's say the AI notices that one CHW is consistently having trouble identifying the symptoms for malnutrition. It doesn't just flag it for a supervisor. Nope, it automatically sends a personalized little training session directly to their phone, maybe a short video or a few simple questions, and it even follows up with quizzes to make sure they've got it. We're talking continuous adaptive learning for an entire national workforce. And finally, let's talk about getting crucial resources where they need to go. Based on all the data it's seeing, the AI can actually predict where a measles outbreak is most likely to happen next. So what does it do? It generates the most efficient vaccine delivery routes and schedules for health workers. And then it tracks every single vaccine dose so there is complete accountability in the supply chain. Just incredible. So when you step back and you put all of these different pieces together, what's the big picture impact at a national level? Well, you get a health system that is fundamentally smarter, faster, and stronger than it was before. And let's go back to that administrative nightmare we talked about earlier. With this new AI co-pilot handling all the digital paperwork, the estimated reduction in that workload is a staggering 70%. That is a game-changing amount of time that's given directly back to patient care. And this chart really just visualizes that whole strategic shift. The entire public health system can now move from a state of being constantly reactive, always chasing the latest emergency, to being truly proactive, where they can see what's coming around the corner and actually prevent it from happening. The long-term benefits for the nation here are just immense. You're scaling the best medical expertise across the entire country, you're enabling proactive health management, you're empowering your frontline workers, and you're doing it all while maintaining full operational sovereignty with workflows that are completely auditable and compliant. All of this brings us to a really powerful final thought. The Eagle AI isn't just another app or a piece of software you install. It's something much, much bigger than that. This quote from the project's own vision statement just says it all perfectly. This is about transforming all those fragmented digital tools into a single national AI health operating system. It's one intelligent, action-focused layer that connects every worker, every clinic, and every single piece of data into one cohesive, responsive unit. So we end right where we began, but this time with an answer. What happens when a nation's health system can finally act at the speed of its own data? Well, it becomes proactive, it becomes incredibly efficient, and at the end of the day, it saves more lives. It really becomes the future of public health.